Dr. Alan Blotcky is a clinical and forensic psychologist in private practice in Birmingham, Alabama. He's also a clinical associate professor, Department of Psychology, University of Alabama at Birmingham, I'm sorry. Dr. Blotcky specializes in high conflict divorce cases that involve parental alienation and false allegations of abuse. He's testified in many cases. He's retained expert. He is a retained expert throughout the country. I'm sorry. Dr. Blotcky has also published 30 articles on divorce, false allegations of abuse, and parental alienation. He's the co-editor of Parental Alienation International, the newsletter of the Parental Alienation Study Group. It's all yours, Dr. Blotcky.
Okay, thank you very much. I'm glad everybody's here, and we're going to try to cover a lot of ground in a pretty short period of time, and I welcome your questions, comments, whatever. I've got some PowerPoints, and if you want to put up the first one, if you can. I always like to have visuals as well as audios, so that's why I put together these PowerPoints. The first one should be Guiding Principles in Child Custody Matters.
Yes. Yes, that's what I've got up.
You've already got it up?
Just give me 1 second. I think it's loading on this side if you can't see it already.
Okay. Yeah, I don't see it, but I don't need it. I just want to know when it's up.
Yep, I'm just getting a little bit of loading.
Okay. Okay, perfect. Perfect. That's even better than mine. So I want to start out my talk by going through these pretty quickly, but they're important, and I think they provide important context for us to then dive into parental alienation. So the first point, and it's one that I repeat often in cases, is that children naturally and instinctually want to love both of their parents freely without any interference or impediment. That's just common sense, but people forget that. Children want to love their parents. They do love their parents. They come into this world and make an attachment very quickly to their parents. And so it's abnormal to think, it's abnormal if a child doesn't love a parent in a general sense. So children naturally want to love their parents. Next, when a child is aligned with one parent against the other parent, that is a red flag for a problem. And alienation is one of those problems. In other words, it's not healthy and normal for a child to be overly aligned with one parent against the other parent. That's the key phrase. Third, extremely important point, children and teenagers are highly suggestible and easily swayed, cajoled, bribed, pressured, coached, brainwashed by a parent or even other authority figures. And when I say children and teenagers, I mean that. I mean little kids, older teenagers. And it doesn't matter. I've had people say, well, my child is too intelligent to be pressured or bribed or brainwashed by another parent. It has nothing to do with intelligence. It has to do with children's feelings about their parents and how easily they want to please them and how easily they can be made to feel responsible for their feelings. So children and teenagers are highly suggestible when it comes to their parents. Next point, very important point. Children who are alienated, and again, we'll get into parental alienation in a minute, but children who are alienated, teenagers who are alienated, have a very distorted view of both of their parents. Okay? They see the favored parent as all good. They see the rejected parent as all bad. The point is that their perceptions and beliefs are inaccurate and distorted and compromised. So you can't take what they say at face value. I say that all the time. You cannot take what an alienated child thinks and believes at face value. Next point, children and teenagers, especially those who are alienated, do not know what is in their best interest. I encounter attorneys and judges all the time who believe, well, I'm going to do whatever the child says. No, children and teenagers, for a variety of cognitive and emotional reasons, do not know what's in their best interest. You cannot ask them to make adult decisions. So that is a huge mistake that often occurs. Next, research clearly shows that shared custody is better than primary or sole custody in most cases. Not in all cases, but in most cases. And that's one of the reasons you're finding a shared custody legislation in a number of states that have already passed, and in some other states where it's on the table. Seventh, a child's long-term adjustment is contingent upon having a good relationship with each parent, not just one. That's connected to the shared custody research, meaning a child does best when a child has a good relationship with each parent, not just one parent. And then the last one I threw in because it's one of my pet peeves, and that is winning a case is not the simple goal. Determining what is in a child's true best interest is. A lot of times I find myself in the middle of high conflict parental alienation cases, and I sit back and I think, each attorney just wants to win the case. They don't really care about what's in the child's best interest. Well, that's not winning the case. That may be winning the case in their mind, but that is hurting the child, and our whole goal should be to do what's best for the children. Okay, now can we go to the next? The next PowerPoint will be, I lost you. Yep, that's it, you got it. Okay, so let's dive into parental alienation per se. Parental alienation is basically defined as the attempt of one parent to sabotage and even sever the child's relationship with the other parent for no legitimate reason. That's the key phrase, for no legitimate reason. And so if a parent is successful in turning the child against the other parent, that's what we call parental alienation. The child has the condition known as parental alienation. Okay. We know that parental alienation of the child can be divided up into three categories: mild, moderate, and severe. So mild parental alienation would be where the child doesn't really want to go visit the other parent, but will, and once that child is with the other parent, the child is fine, enjoys the parent, loves the parent, things are good. So that's very mild parental alienation. Moderate parental alienation would be when a child does not want to go visit the other parent, resists going to see the other parent, and if you make the child go, once the child gets with the targeted parent, the child is very difficult, withdrawn, accusatory, angry, difficult, oppositional, and so it's a very difficult, uncomfortable, antagonistic kind a visit. So that's what we would call moderate alienation. The child goes if they're forced, but once they're in the home, they're pretty miserable and they try to make everybody else miserable. Severe parental alienation is defined as the child refuses to visit the other parent, refuses to communicate with the other parent. There is a total cutting off of all of the relationship with the rejected parent. So those are the three different categories. And we'll talk more about those categories later on when we talk about treatment. So parental alienation, again, is defined as one parent trying to undermine and sabotage and sever the child's relationship with the other parent for no legitimate reason. So the next PowerPoint that you're looking at, we know that there are basically 17 alienating behaviors that an alienating parent will engage in. So let me say right off the bat, an alienating parent does not have to engage in all of these. And in fact, most alienating parents do not engage in all of these. It may only take 2 or 3 in any given case. In my experience, most alienating parents engage in 6 or 8 or 10 of these, but not necessarily all of them. That's not a requirement. So let's go through these pretty quickly, one at a time, just to say it out loud so it'll stick in your head. The first one is bad mouthing. Obviously, a parent saying negative things to the child about the other parent. Number 2, limiting parenting time, a very common one, where a parent literally does not let the child go visit the other parent or restricts it in other ways. Third is interfering with all types of communication between the child and the parent. For example, phone calls are stopped, or you can't text anymore, or you can't send emails. So communication is either stopped or severely restricted. Number 4 is not mentioning the target parent at home. In other words, playing like that parent doesn't even exist. 5, withholding love and approval if the child does not reject the other parent. In other words, kind of bribing them with love and affection. If you reject that parent, I'm going to love you and give you things that you want. If you don't reject that parent, I'm going to withdraw love and I'm going to withhold love. 6, telling the child that the targeted parent does not love them. Telling the child that your mom or your dad, whatever the case is, doesn't love you, that they're unloving and that they don't love you. 7, forcing the child to choose between parents, literally setting it up to where you force the child to make some decisions about loving you or loving them. You can't love both. 8, creating the impression that the rejected parent is dangerous. That's a very common one that I see all the time. In other words, saying and doing things to the child to make the case that the rejected parent is dangerous and you should be afraid of that parent. 9, forcing the child to reject the rejected parent. In other words, literally forcing the child to make the decision to stay away. And that can be done in many overt and covert ways, in many verbal and nonverbal ways, but communicating that to the child. 10, and this is a very common one, confiding in the child about court and adult topics. In other words, drawing the child and putting the child in the middle of the court battle that's going on, telling the child things, and telling the child things for a very particular reason, which is to paint the rejected parent in a very negative way. 11, asking the child to spy on the rejected parent. In other words, when you go on visits, that parent is so unloving and so dangerous that I need you to spy on him or her and then come back and give me that information so I can try to use that against them. 12, asking the child to keep secrets from the rejected parent, meaning that the child and the alienating parent have this special bond and special relationship that is very different than what the child has with the rejected parent. So we can keep secrets from that parent and don't let him or her know. 13, referring to the rejected parent by first name only. In other words, making them a non-parent by referring to them as Jim or Mary instead of mom or dad. 14, referring to a step-parent as mom or dad. In other words, you're going to call your biological mom or biological dad by his or her first name, but you're going to refer to your step-parent as mom or dad. 15, withholding medical and educational information from the rejected parent. A very common strategy and tactic. Not even putting the biological parent's name on medical forms or school forms, or letting them know about school events or doctor's appointments. 16, changing the child's name. 17, undermining any authority of the rejected parent. In other words, you don't have to listen to that parent. I'm your parent. You and I have this special bond. So those are the list of 17 different alienating behaviors that have been studied via research that we know that alienating parents engage in. And once again, they don't have to do all of them. They can only do 4 or 5 sometimes. What matters is the frequency and the intensity of the alienating behavior, not necessarily the absolute number of them. So I've seen very alienated kids with an alienating parent who only did 2 or 3 of these behaviors, but they did them intensely and they did them frequently. So these alienating behaviors are really important. Obviously, some of them are more observable than others. Some of them occur behind closed doors, so it's really hard to ever see them. Other ones you can see. So some of these behaviors are difficult to uncover and identify. Other ones are more easily done. Let's go to the next slide if we can, please. Perfect. Okay, this is a really, really important slide because what we're going to talk about now is, so we just talked about the alienating behaviors of the alienating parent. Now we're going to talk about what are the 8 major characteristics of an alienated child. In other words, these pinpoint how we can identify an alienated child. Number 1, the child goes on basically a campaign of anger and negativity toward the rejected parent. In other words, literally everything that comes out of the alienated child's mouth is negative about the rejected parent. It's angry, it's negative, it's accusatory, it might even be false, it might even be total lies, but I can promise you the lies are negative, okay? So the child is on what we call a campaign of anger and negativity. Point 2, the alienated child will provide or produce what we call weak, frivolous, and absurd reasons for why they're alienated from the parent, okay? So when I said from the very beginning that parental alienation is an attempt by a parent to turn the child against the other parent for no legitimate reason, That's what I'm talking about now. No legitimate reason is the key phrase. I've literally had kids tell me that the reason they don't want to see their parent anymore and hate their parent is because she's a lousy cook, or she won't play video games with me, or I don't like dad's friends. Most of them are frivolous. Most of them are weak and vague. So let me just interject right now. What are legitimate reasons for a child to distance themselves or reject a parent? Okay? Because there are legitimate reasons, but the legitimate reasons have to be serious: physical abuse, sexual abuse, unremitting substance abuse, neglect, abandonment. Major reasons why a child would reject a parent. Anything short of that is not considered a legitimate reason. And why do I say that? I go back to the very first thing I said at the beginning of this talk. Children naturally want to love their parents. So the reasons for a child to literally cut off another parent have to be profound to make it legitimate. Let me also say that people have studied physically and sexually abused children, verifiably abused children, and they profess still love for their abusive parent. They still want to have some kind of a relationship with their abusive parent. That's different. These are kids that are on a campaign of anger and negativity, and what they'll tell you is, I hate my parent, I don't want to see my parent, I never want to see my parent again, and I want to be cut off from them completely. That's a very different kind of message than even physically and sexually abused kids. Okay? So point 3, lack of ambivalence about the rejected parent. That fits with what I'm saying. These kids are totally negative. There's no positivity about the parent left. If you ask an alienated kid, let's say we have a child who's alienated from mom and doesn't want to see mom, doesn't want to have a relationship with mom, and I say, tell me something positive about your mom. They'll say, I cannot think of a single positive thing. There is nothing positive. Everything about her is negative. So there's a lack of ambivalence that is just not normal or healthy or expected in children and teenagers. It's a huge red flag. Number 4, really important, independent thinker phenomenon. What alienated kids will say to you is, I've come to this decision about my dad, and nobody has influenced me about it. It's all me. And that's an 8-year-old saying that, or a 10-year-old saying that, or a 12-year-old saying that. And you know that that's just not feasible, that they have been influenced by their other parent or other people. So when a child says, I've come to this decision on my own, it doesn't make sense. Again, why? Because children naturally want to love their parents. So they're not going to come to that decision on their own. Number 5, absence of guilt about the treatment of the rejected parent. Alienated children treat their rejected parents horribly. They yell at them, they cuss at them, they make accusations toward them, they tell them they hate them, they don't want to ever see them again. They treat them terribly, and yet they show no guilt, no remorse, no feeling about how terribly they've treated that parent. That's not normal, that's not healthy. Number 6, alienated children will reflexively and unwaveringly support the favored parent. No matter what the issue is, no matter what the topic is, the alienated child will always support the favored parent and will go against the rejected parent. Totally, not most of the time, totally. Number 7, alienated children will copy the words and scenarios that they hear from their alienating parent. They will literally copy the words that they've heard. They will literally borrow narratives and scenarios that they hear from their alienating parent. So I've had 5-year-olds say, I don't want to see my dad, he's a narcissist. Please, 5-year-olds don't know that word. It's a word that they've heard, and they're repeating it, and they couldn't even begin to tell you what that means. Number 8, rejection of the rejected parent's extended family. So not only will an alienated child reject a parent, they will reject that parent's extended family. So they won't see grandparents, they won't see aunts and uncles, they won't see cousins. So these are the basic 8 characteristics of an alienated child. Again, an alienated child does not have to have all 8 of those, although in most of the cases that I've seen, they have most of these. They don't have to have all 8. They might only have 6 or 7 or 5. They don't have to have all 8. They're not going to have just one, I promise you. So these are the 8 characteristics of an alienated child that will help you in your formulation of what's going on in this particular dynamic. All right, let's go to the next one, please. Okay, so Dr. Bill Burnett developed what he calls the 5-factor model of diagnosis. And this is a pretty simple but excellent way of conceptualizing the case, okay? On this slide, the 5-factor model of diagnosis, all 5 of these have to be present, okay? So let's go through these. Number 1, the child resists or refuses a relationship with the targeted parent. Well, that's a given, right? That's why we're here. We're here to talk about a child who is either completely rejecting a parent or partially rejecting a parent. But that's condition number 1. That's factor number 1. We have a child who is rejecting a parent. Factor 2, the presence of a prior positive relationship between the child and targeted parent. Very important. What this says is, in order for parental alienation to be diagnosed and for us to understand that it's present, this child and this targeted parent had to have had a good relationship at one time. In every case, that's true. In every case of parental alienation, at one time, the alienated child and the rejected parent had a good relationship at one time. Regardless of what the alienating parent might say, the truth is they had a good relationship. Maybe they even had an excellent relationship. It might even be that they had the closest relationship. But that is condition factor number 2. Number 3, that there is an absence of abuse, neglect, or serious deficient parenting by the rejected parent. This gets back to the no legitimate reason part of the equation, meaning the rejected parent has not been physically abusive, sexually abusive, unremitting substance abuse, neglect, or abandonment. If none of those are present, then there is no legitimate reason why a child would be rejecting a parent other than parental alienation of some kind. Factor 4, that the favored parent is engaging in some or many of the 17 alienating behaviors that we went through earlier. So that's factor 4. Factor 5 is that the alienated child is exhibiting some or many of the 8 characteristics that we just went through, the 8 characteristics of an alienated child. So if you have a case and all 5 of these factors are met, then parental alienation is the diagnosis at hand. If all 5 factors are not met, then you cannot make the diagnosis of parental alienation. So this is a very clear model. It's excellent. It basically summarizes the different factors that you have to consider in the diagnosis. Let me just say at the end of this part of it, because I hear this every day, what I hear is parental alienation doesn't exist because it's not in DSM-5-TR. The truth of the matter is the words parental alienation are not literally in DSM-5-TR, but the intent of it is, and it is subsumed under a V code called parent-child relational problem. And it's subsumed under that. Therefore, that's how we code it. And it is a diagnosable condition according to DSM-5-TR. And if you read what it says in DSM-5-TR, it says essentially there are many examples of behavioral problems that are included in this category, okay? And then we have a statement from the DSM-5 chairperson and a second person of DSM-5. We have statements from Drs. Youssef and Applebaum confirming that parental alienation is subsumed under parent-child relational problem. I'm going to read you this email from Dr. Youssef. It is not necessary to literally have the term parental alienation as an example of parent-child relational problems, since the description of parent-child relational problems already encompasses the kind of interactions designated as parental alienation. Okay, so when people ask you or make the statement that parental alienation is not in DSM-5, what you should say is, yes, it is. It is subsumed under parent-child relational problem. I'll give you an analogy. Everybody believes there's such a thing as battered woman syndrome. We've talked about it for decades. It's in the court system, okay? You will not find battered woman syndrome literally in DSM-5, but it is subsumed under several different potential categories. Everybody knows that there is such a thing as sex addiction. Sex addiction has been a clinical problem that we've known about for decades. It's accepted in courts, but you will not find the word sex addiction anywhere in DSM-5-TR. But that doesn't mean that it's not subsumed under this category or that category. So it really is a red herring. It really is a criticism that certain people latch on to, but it's simply not valid, and it's really pretty disingenuous because it is subsumed under that V code. All right, so let me think for a minute. Is there anything else we need to talk about as far as basic diagnosis? And y'all can ask me questions, but I'm going to get into treatment now, and I don't want to run out of time completely. Oh, I forgot about that. Let's run through this real quickly, okay? Because it's one of my pet peeves, and it's one of my areas of expertise, which is false allegations of abuse. Let's run through this real quick, and then we'll get to treatment. So there's been some recent research headed by Jennifer Harmon, which basically says that in parental alienation cases, roughly half of them have false allegations of abuse. What do I mean by a false allegation of abuse? It's an allegation of abuse that's false, okay? It's either false by misperception or it's false by fabrication. No matter how you want to define it, and we can spend a lot of time talking about that, but we're not going to today. The bottom line is it's an allegation that is false. Half of parental alienation cases have false allegations. Now, why do you think we have false allegations of abuse in parental alienation cases? The reason we have them is that they're used as weapons by an alienating parent, okay? So even though it's not listed as a separate alienating behavior in our list of 17 alienating behaviors, it really is a common alienating behavior by an alienating parent, and that is to lodge a false allegation of abuse against the other parent. The other reason that they crop up and that parents use them is that they're effective in turning the case upside down. Oftentimes it'll stop the proceeding. Oftentimes judges will render very quick decisions just based on the allegation. And it really can make things topsy-turvy, which is the purpose of it. Let me just say one more thing and then we'll get off this and we'll get to treatment. False allegations of abuse are usually triggered by certain events during a custody or post-custody timeline. For example, if a parent files for divorce or files for primary custody of the children, or files for permission to relocate to another state, or starts a new romantic relationship, or doesn't like the judge's ruling for 50-50 shared custody. Those are the kinds of events that will trigger a false allegation of abuse. And a lot of times that false allegation of abuse will be lodged within days or weeks of one of those kinds of events. So we're going to get off of this, but I just want to say false allegations of abuse are a major problem in court proceedings. They do occur in about half of the cases, and you really have to deal with them in a proactive and firm kind of way. All right, we've only got 15 more minutes, and I want to leave some times for questions, but we got to get to treatment. We got to get to treatment. So treatment, let me say this, and this is an important thing to say. The treatment of parental alienation can be successful. The treatment of parental alienation depends on the severity of the parental alienation. In other words, the treatment for mild parental alienation is different than the treatment for moderate parental alienation, which is different than the treatment for severe alienation. I'm not going to talk about the mild. I'm going to talk about the moderate and the severe today. And I'm going to differentiate the two, okay? Right, there is no slide for treatment. So for moderate parental alienation, here is essentially the treatment template that needs to be used. The alienating parent has to have individual therapy with a therapist who is experienced in parental alienation so that that parent can stop the alienating behavior. That's the singular goal of that intervention, is to get that parent to stop the alienating behavior. On the other side, at the same time, concurrently, the alienated child and the rejected parent have to have what we call reunification therapy, with a therapist who is experienced in reunification processes, with the goal of reuniting and repairing that relationship. The point I want to make is that both of those components are critical. The biggest mistake that judges make, in my experience, is that they will order the alienated child and the rejected parent to have reunification therapy, but they won't do a thing with the alienating parent. Reunification therapy alone will fail. It will not be successful. And the reason for that is that the alienating parent is still trying to sabotage things and will do so. They will sabotage the reunification therapy. So both components have to occur concurrently. Now, in severe parental alienation, there's a different treatment template. In severe alienation, where the child has completely cut off from the rejected parent, there are no visits, there's no phone calls, there's no communication of any kind. A child may not see that parent for month after month after month, year after year after year. Here is the treatment template that will work. First of all, you have to remove the child from the alienating parent and place that child with the rejected parent. And that transfer should be fast and clear and decisive, not gradual, episodic, indecisive. So that the custody of the child has to be changed from the alienating parent to the rejected parent. That's part one. Part two is that the alienated parent, the alienated child, and the alienating parent should not have contact for at least 90 days. None. No phone calls, no emails, no text messages, no visit, no smoke signals, nothing for 90 days minimum. And then the third component, obviously, is that the alienated child who is now placed with the rejected parent, they should have reunification therapy to repair and restore their relationship. Now, at the end of 90 days, if the alienating parent has made significant progress in their individual therapy, again, they have to have their own individual therapy. If their progress is significant, then they can begin to have supervised visits with the alienated child. If they have not made significant progress, then their lack of contact with their child should be maintained. So that's the basic template for severe alienation. And I will say to you that I've been doing this long enough with many, many cases. I have seen a number of cases where I have recommended and the judge concurred, and the judge removed the child from the alienating parent and placed that child with the rejected parent quickly and decisively, and that transition was excellent. Now, I can remember one case where it was the most alienated child I have ever seen in my years of work. And after that child was placed with the rejected parent, it took about 2 months for that child to come around. And for the last 6 years, that child has been doing phenomenally. So these treatment templates that I just described to you for moderate alienation and for severe alienation will work. Let me say one more thing and then we'll open it up for comments and questions. There are workshops like Family Bridges that are excellent. So if an alienated child and a rejected parent have access to a workshop like that, that's fantastic. What I say though is a workshop is a workshop. It's an excellent beginning, but then you will need reunification therapy after that to sort of maintain and bolster the progress and the improvement. Okay, I know we've gone through this quickly. We've only got about 10 minutes left. I would love comments and questions, and see if I can answer them in our last 10 minutes. So please ask me anything, say anything.
Anybody has some questions? Let me see if anybody's got any questions for Dr.
I do.
Go
Okay?
ahead.
It was fabulous. I mean, really, really, really great, well organized, put it out there great. I would
Thank
love
you.
to have access to your materials. Can we get those?
So the first thing that I would do is, let me answer it a couple of different ways real quick. First of all, get on my website, and I think some of them are listed on my.
Alan Blotcky at att.net.
No, I think it's
Uh-oh, okay.
alanblotkyphd.com.
Whoops.
Okay?
PhD.com.
If that doesn't work, send me an email and I will email you some of the articles. That's the first part. The second part is there are some other references that I want to recommend right now for any of you who want to look at like the basic important stuff. For example, there's a tremendous article from 2022 by Jennifer Harmon, Richard Warshak, Demos Lorendos, and Matthew Florian. The title of it is Developmental Psychology and the Scientific Status of Parental Alienation. It's published in Developmental Psychology.
You know
It
what?
is
That's
the,
great, but you think that I'm a legal assistant that can take notes quick. You got to run that by
well,
me one more time.
so look, send me an email and I will
Okay.
send you back my stuff and also the 2 or 3 different articles I was just going to mention. But that article that I just said to you summarizes where we are in parental alienation scientific research. And so I talk about that article every day in court, believe me. But send me an email.
I'll do that. Thank you so much.
I have a question.
Go
Yes,
ahead.
I have a question.
yes.
So if there's limited funds where you can't hire an expert and there's moderate to severe parent alienation, if you can get a child custody evaluator or even a social worker, can they recommend, or can the attorney, state any of these, the reunification
Unification therapy.
counseling?
Yeah, but let me just say this, and I've spent my whole career doing custody evaluations. So
Okay.
now I feel like, so what I'm about to say feels a little bit odd to me because I've done so many of them myself, but you got to be really careful. And here's why you have to be careful. A custody evaluation is only as good as the evaluator. And if you have an evaluator who doesn't understand parental alienation, and believe me, I've seen plenty of them just in the last week. But if you have an evaluator who doesn't do a good job for whatever reason, then where are you going to be? You're going to be stuck. So you have to be careful with custody evaluations because sometimes they either don't get it or they don't take a firm stand. And what you've done is wasted 6 months and thousands of dollars, and you end up with nothing that will help this judge make good decisions. So
Well,
all I'm saying is be careful with them.
but if there's limited funds where there's not money for an expert and you've got maybe the evaluator, which they do on a sliding scale. So,
Okay.
sometimes it's only 300 or 600, but you're trying to just do the best you can with the limited
Yeah.
resources.
Yeah.
I guess, the attorney can just say, Judge, these are the facts. I think this is parent alienation, and try to ask for these programs, but you don't have the
Absolutely.
You just don't have the expertise. And I'm just wondering about, because a lot of these cases, they don't have the resources, and it's
Okay.
Yeah.
So look, what you're saying is right. If you can't get an expert for whatever reason, you don't want them, you can't afford them, whatever, that's fine. Make sure you have a forceful attorney who will do exactly what you just said,
Okay.
and convince that judge to get a custody evaluation and then to abide by the recommendations.
Okay.
Thank you. I think Brianna, you have a question?
Yes, thank you. Thank you so much, by the way. And my question
Thank you.
is when you say reunification therapy, now is that different than this term, what's coming out, reunification camps
Well, the
or treatment?
reunification
Is
camp
it
is what I just referred to as a workshop. In other words, it's a time
okay?
limited thing that an alienated parent and the rejected parent will go to, whether it's 2 days or
Hmm.
4 days or 8 days or however many days it is. Those are excellent, but they're the beginning of the
A little
process,
buddy
not
one.
the end of it.
So I guess there's a huge thing out there in the alienation community that the camps are really, really bad. Do you know where they're coming from? They're just like, they're horrible. Don't do
Yeah,
it.
well,
Like, we should fight this. What's that
that's
about?
they've gotten bad press, right?
I have a
I don't know.
question. I have a
Wait. I just
question.
want to hear his answer.
Oh,
I
sorry.
No,
need to
no,
hear his
my
answer.
answer to it is I think they've gotten bad press, and I would not believe what you read in the mainstream media. Look, let me just say this. There is a small but vocal group of critics of parental alienation. And I've written about it, I've published about that. It's a problem because they're promulgating misinformation. And I think one of the pieces of misinformation that they keep talking about is these reunification camps, as they call them. The Family Bridges has research to support it. It's excellent. It's a great workshop. So you can't always believe what you read.
I have a question for you.
Yes,
Um, if there's an allegation of sexual abuse in a case, how do you
yes.
go about knowing whether to diagnose parental alienation or believe the allegation?
Well, I mean that we don't have another hour. I mean that's the ultimate huge task of somebody like me. That's the kind of case I love. I get in there and I roll up my sleeves, and you have to figure it out. You have to look and see, are all these different criteria met for parental alienation? So you have to tease it apart. You have to look at collateral information. You have to look at emails and text messages and pictures. You have to interview the parties at hand. You have to kind of do an investigation and put the pieces together. So there's not an easy answer to that, except to say that if you figure out that parental alienation is present, that makes the allegation more likely to be fabricated than real. It only statistically it makes it that way. That's all I'm saying, because half of the cases have a false allegation of abuse. But you literally have to roll up your sleeves and do the investigation and figure it out.
What about in cases where the alienating behavior is happening, but the child has not actually become alienated yet? That's where
Yes,
we
great
seem to be
question.
right now. It's a lot
Yeah,
easier to prove the
yeah.
emotional bruises than the other way around.
Yeah, that's a great question. That happens, and what makes that hard? So here's the real answer to that is alienating behavior by a parent has a cumulative effect. And so even though your child may not be alienated today, Friday, that alienating behavior could result in alienation literally tomorrow. It could switch tomorrow. It can switch overnight. Now, convincing a judge of that is tricky. I've had judges turn to me and go, but you're saying the child's not alienated. Why are we talking about it? Well, Judge, it's because if this alienating behavior continues, it's likely that this child will become alienated. And the judge will say, I don't care about likely. I only care about what's before me. So you're right, it's tricky, but the real answer is that a child can turn overnight. And so that's why it's important to stop a parent from alienating behaviors. Questions, more questions?
Yeah, I
Fire
tried
away.
to
We
get
got a
on
couple
your,
more minutes.
send you an email, and I don't have, it's not recognizing your email address, sir.
Alan Blotky at att.net. ALANBLOTCKY at att.net.
Thank you.
Thank you.
Are you familiar with legal abuse syndrome and how it relates to parental alienation as well in these cases?
No. Tell me what legal abuse syndrome is.
I don't have an hour to do it, but it's abuse in the system that escalates from parental alienation that includes the alienating parent and possibly corruption in the court and pairing with the professionals that are involved and using the court to their advantage to abusive litigation, frivolous filings, things like that.
Well, I will say this. I'm not gonna say that what I'm about to tell you in my mind is not about corruption per se, but I will tell you this. I've seen a number of cases, and I'm seeing some right now that I'm involved in, where the attorney for the alienating parent is getting continuance after continuance after continuance, stalling the process for years.
Yeah.
And the judge is allowing her to do that and is not stopping it and adjudicating this case properly. I had a case where an alienated child did not come in for trial for 4 years, and by the time we got to trial, the child had aged out, and so it was really kind of a moot point. So
Yeah.
that kind of scenario happens all the time, and it's maddening as hell. I don't know that I would say it's at the level of corruption exactly, although I wouldn't rule it out.
Karen Huffer is an author that wrote at least 3 books that I've ordered, and it goes into detail just on the same type of subject, but it stems from parental alienation a great deal.
Well, it doesn't surprise me, and I think the examples that I just gave you are consistent with that.
Yeah.
I don't know that money is being transferred, but there is, I think there is a groupthink that goes on in the legal system. They don't like experts like me because I'm an outsider and I shoot straight and I try to tell it like it is for the child, no matter which side it falls on. And they don't like that. They play games and they all want to win in their own way. And so they don't like me and they try to keep me out every step of the way. Well, I don't think that's corruption exactly, but it's a sucky system, I'll tell you that.
Can I say,
Go ahead.
I'm sorry, go ahead.
I'll end on this. When you mentioned the 17 behaviors checklist, I was going through in my mind what the court made orders to say, each one of them, I would go, okay, the court ordered that. They ordered no pictures, no videos, so you can't prove anything. They removed the kids from the parent. You can go along and see that connection where the courts are actually coordinating with that favored parent.
Yeah, what you're saying is exactly right. The court will say, okay, no more pictures or no more spying or no more videos. But here's the problem. When the parent continues to do that stuff, there's no negative consequence.
Mm-hmm.
There's no negative consequence to a false allegation of abuse.
Yep.
So the court, I always say the court is really not set up to deal with these kinds of cases. And they do a very poor job, and it's sad, but we got to do what we got to do and do the best we can.
Yeah, thank you.
And can I say a point too is, the family law code says it's best interest of the children. And
Yeah,
attorneys are going to advocate for their client, and instead of going by advising their client on the law and recognizing these issues and trying to speak to their client about it, they're going ahead and putting all this forward. And then the other, the target parents, attorneys trying to combat it. But nobody sees what happens to these kids when they age out at 18 and all the long-term effects.
Right.
And so I think the legal profession also has some duties as well. I mean, I know you need to advocate for your client, but it is best interest of the family law. And attorneys, I think they need to be reminded of that.
Yeah, I mean, Dr. Burnett and I published a paper specifically saying that winning in these cases is not the way you think of winning. Winning would be for the child not to be alienated from a parent anymore. That's the win.
Right.
But if you're an attorney for an alienating parent, you know what you think? Man, this is going to be an easy case because my client's doing all the work for me.
Recording stopped.
Yes. And I think that, I mean, I've seen it firsthand with attorneys, and I've seen now the effects that those kids are going through, and they didn't win. They didn't win.
Terrible.
And so I think the legal profession, also the attorneys, need to be educated on the parent alienation, because it is best interest of the child. And to alienate a child, to see that your client's alienating a child, that is not going to be in the best interest. And how does that go when you're a lawyer, that you're trying to follow the law, you're trying to get legally advised the law? So, but yeah, we have a lot of work to do in this area for sure.
Yeah, we have a lot of education to do, but
a lot of education.
Lots of roadblocks, because my experience, and I've done hundreds of these cases, is most of these attorneys, they don't really want to understand it. They just want to win their case the quickest way they can.
Exactly. And I think with education, to see what happens to these kids after they're 18 in their adulthood, and that attorney helped get those results. And
that's right.
And it's a sad day, really, when it's a best interest of the child and family law. So anyway, I'll see what I can do to help with that. But anyway, whether I'm on one side or the other, one side or the other, you advise your client of the law and what's going on and weakness and strength of their case.
And I've told attorneys before, an attorney of an alienating parent, and they say, well, what do you want me to do? Be honest with your client. Tell your client to stop doing it. They're not going to stop doing it. Well, then maybe you should get off the case. Maybe you aren't the right person for that case. Stand your ground. Be real, be truthful, be honest.
And the attorneys that just want to take a blind eye and just do whatever their client wants and try to get those goals met without seeing the ramifications. So it
is sad, and look, we just have to keep doing what we're doing and try to educate as best we can.
Well, thank you. This was an excellent presentation. Thank you.
Thank you. I appreciate it. Are we out of time?
Dr. Blotcky, I have a question.
Yes, ma'am.
The treatment models for moderate and severe parental alienation that you went through, if we have experts and they are kind of at a loss as to what treatment to recommend, how do we educate them? Are these published models that you are recommending, or are these things that you have come up with and we would refer them to you?
Well, you can refer them to me. Dr. Burnett and I have just submitted a paper that summarizes exactly what I just went through as far as treatment goes. Those professionals can dig into the literature and find out what I'm talking about. But it probably would be easier just to refer them to me, and I'll give them the bottom line, or I'll send them my paper. No, it's not me. I'm the mouthpiece for the accumulation of science that we have in this field. So we know through science that those templates are the best and they will work. So let me just say what you're bringing up is a good point, which is, you know, a lot of times I will go into court and maybe the attorneys will get it after I talk, and then maybe the judge will get it, but they always say then, okay, so what do we do?
Recording in progress.
And that's when you have to explain the whole treatment stuff. So that's really important. But yeah, you can refer anybody you want to me, and I'll give them the articles that they need.
Thank you.
Thank you for the question.
Recording in progress.
Anybody else have a question? I don't want to cut anybody off.
I have a question. Just since everybody's done such an amazing job with such questions, I'm getting so much insight, and I appreciate being in a group where people understand
Right.
and want to make change.
Right.
One of my question would be, just out of curiosity. I know you said you've done hundreds of cases. How many do you think have been successful that didn't seem like they were going to be? Like maybe they were one of the worst cases you saw, and it was long and rough, but what was the success due to?
So I'll tell you about a case I'm involved in right now. This is a case where a son had not seen his father in at least 5 years, maybe longer. The mother and father had been involved in litigation for probably 15 years. I mean, it was ongoing. It was a total mess. The attorneys didn't understand anything, but the alienating mother's attorney was determined to keep this boy away from his dad. So long story short, I got appointed to be the reunification therapist. And I've been meeting with them, I would not say, I mean, semi-regularly, not regularly, but semi-regularly. And things seem to be thawing and getting better, but it's been a long, hard struggle. The most alienated, I think I mentioned earlier, the most alienated boy I had ever seen in all my years was removed.
Hi, Dr. Blotcky.
Yep, we're out of time.
Yes.
Okay.
If you're available, we'd love to have you at the very end of the symposium. We are going to have all of our speakers come back and answer some more questions. So if you guys have questions, feel free to send those questions to us.
Yeah, I don't know that I can do that, but I will try. I don't know that I'm available at that time, but I
Okay,
will try.
perfect.
If not, get the questions to me, or people can email me. If you'll put up my email address again, everybody can have it. They can certainly email me, and I respond to my emails.
I'm just going to share.
Thank y'all.